Hi, my name is Salvador Carrillo. I'm going to explain the concepts of community risk reduction and its values for organizational growth and efficiency. Community risk reduction is a process or a program with actions and services used by the local communities that helps with fire and injuries prevention and mitigates the loss of property, the loss of life, and other major disasters within the community. To have a community risk reduction plan, there has to be a risk assessment in the community. Identify the locations and populations with a high risk, prioritize those communities and their needs, develop a strategic plan and tactical objectives to mitigate the risk, prepare and put together a community risk reduction plan, implement the plan, and monitor the results. Continue to evaluate the effectiveness of the plan and modify it as needed. Some of the data used to identify the high risk of the community are our census reports, which provides information about the population, their age, sex, race, health, community economic standings, and poverty status. Another tool that the fire and EMS services can provide is the yearly report with valuable information about the high risk residentials and areas of high call volume. The firefighters can also be an asset to the data information, being the boots on the ground personnel that can see for firsthand the priorities and the needs of the community. After data collection and input from the firefighters responding to the residences, it was decided that smoke detectors are the best risk reduction item. In the United States, smoke alarms are installed on 96% of the homes, but 20% of those are not operational, and 4% of those do not have one. Some statistics by the National Institute of Standards and Technology shows that 3 out of 5 home fire deaths result from fires in homes without smoke alarms. More than one-third of those home fires deaths resulted from fires which no smoke detectors are present. The risk of dying in a house fire is almost cut in half with a working smoke detector. If every house had a smoke alarm, fire deaths in the United States could drop to 36%. That makes approximately 1,100 lives per year. Despite the progress in home improvements and fire prevention programs, the latest annual report from the Home and Structure Fire Report estimates that 2,600 people perish in home fires every year, which averages about 7 people per day and causes 12,000 injuries in 2019 in the United States. Most of the fires were caused by cooking, heating equipment, electrical malfunctions, arson, smoking. All of these are easily detectable with working smoke detectors. With these causes are all preventable and cause approximately 95% of deaths in a house fire. An estimated 41% of the residential fire deaths occur in homes without working smoke detectors. In the United States, the United States Fire Administration estimates in a year 372,000 structure fires cause 2,615 deaths and 11,825 injuries, costing 8,604,400,000 in property lost. To help prevent these fire incidents, the Fire Department Community Risk Reduction Program will use a five-step process to begin the campaign as a smoke detector installation program. The first step is to identify the risk, which we already did as a smoke detectors. We're going to prioritize the risk, which is the low income and elderly population. We're going to develop the strategies and tactics to mitigate the smoke detectors' deficiencies in the local community, prepare a plan. We're going to implement the plan and monitor the plan. We're going to evaluate and modify it as necessary. The fire department will be using one or more grants. For decades, the First Alert, the company that makes fire prevention and home safety equipment, has donated smoke alarms to local fire departments nationwide. In addition, First Alert and the National Volunteer Fire Council have developed a new smoke detector training program for fire departments across the nation, supplementing smoke alarm donation programs to help local communities with community risk reduction plans. Another agency capable of assisting with the smoke alarm grants is FEMA, the Federal Emergency Management Agency. They have a fire prevention and safety fundings that can assist with the community risk reduction programs. The national average price for a smoke alarm is $20 to $30, and a professional can charge up to $65 per installation. For those reasons, a preliminary 100 units are requested for the initial grant and community risk reduction plan. A request of 100 9-volt batteries is also requested to replace batteries in those smoke detectors with a dead battery. In conclusion, this proposal will obtain smoke detectors for the local community identified as a high risk after assessment and data collection. The lack of smoke detectors in the community increases the chances for the residents to sustain severe injuries or die from an injury caused by a house fire, by failure, or early smoke detection. The fire department will benefit from this program by responding to early detection events that minimize the chances of firefighter injuries from fighting fires at advanced stages. The community will benefit not just for preventing personal injuries, but also the loss of property as well. It is about being prepared and knowing what to prepare for. Thank you very much.